This is a practical demonstration showing the technique required for effective instrumentation. We're going to cover all the instruments that you have in your kit, and we're going to show you that the basic rules apply for any instrumentation, so you can adapt to any instrument you are using. So the basic things we're looking for instrumentation are a modified pen grasp. Most important that we start with the correct grasp of the instrument. We're looking for a solid fulcrum or finger rest on the tooth, close to where you're working. We're looking for a wrist forearm rock to get your power from, not for your finger flexing. You will fatigue and you'll have no power with that. We're looking for adapting the end third of the instrument to the tooth and rolling it around the line angles between your fingers. And we're looking at effective operator and patient positioning and your posture. So I'll discuss more of those points as we go through our instruments today. We're going to start with the 1112 Explorer. The 1112 Explorer is a perfect instrument used to detect calculus. It will also pick up any anatomy in the tooth structure. So if you're feeling things subgingivally, you can't see it, we're all relying on tactile sense. So we want to be able to find out, is it a fissure, is it a fossa, it is a ledge of calculus, or is it an overhang that you're catching on? So when you're using this instrument, we want nice, light, overlapping strokes. Your fulcrum can be an extraoral or an intraoral fulcrum. It's not essential. Extraoral is sometimes good because it will lighten our pressure on our instrument and it will create a much lighter touch. Now, when we're doing it, we've got 3 parts to the instrument, the same as we have in any of our instruments. On our toe, we've got our tip or our toe, we've got our middle third, and we've got our end third. We always want to adapt the very end third of our instrument to the tooth structure. Now, I'm just going to demonstrate on the 1-3 to the 2-3 labally, just so you get the idea. When we're doing that, we just want to use nice, light, overlapping strokes, rolling that instrument around the tooth. We want to get that terminal shank or that lower shank parallel to the long axis of the tooth once we're interproximally. Then we move again onto that next tooth, covering from that midline around, doing all our surfaces away. So just nice and light. If we're feeling something, we will mark it on your chart to show that there's calculus there. Once we get to that canine or the distal of that 2-3, we will then flip the instrument and work and do all our surfaces back towards us. Just nice, light, overlapping strokes so we don't miss anything, and coming back around to that canine. So that's our first instrument that we would use. It's important that we detect calculus on our patients so we can treatment plan. You can also use your perioprobe to detect calculus as well. And we're also using our perioprobe for our main importance is to detect attachment loss. So we're looking at pocket depth and any attachment loss that you find on the tooth. So when we use our perioprobe, it is again a nice light fulcrum. So we can use our extraoral fulcrum as well, the same as we did with our Explorer, because we want a nice light touch. Now again, I'm going to demonstrate on the 1-3 to 2-3. Now we're only recording 3 points when we're using our perioprobe. We record a distal point, a true buccal point, a mesial point, and then the same on the palatal. We'll use a mesiopalatal, true palatal, and distopalatal. But we don't just probe 3 areas on that buccal part. We want to do small, light, continual hopping movements to get around that tooth. The reason why we don't just check the 3 points is we're likely to miss an isolated pocket that can be between those points. So as you can see, we're just slowly walking our way around, and you would be charting anything that was 3 and above. We would then come back on our palatal and be working back along that palatal section. So as I mentioned, you can use your perioprobe for detecting calculus as well, but you have much more tactile sense with using your 1112 Explorer. So it's worth picking it up and finding it out. So we need to know exactly the amount of calculus present so we can work out how many appointments are necessary for your patient to come back for. Okay, the next instrument we're going to focus on are our universal instruments. So the 3 universal instruments you have in your kit are the sickle scaler, which is a H67. You have your SJ3435, also known as jaquette, and you have your universal curette, which is a 4R4L. So we're going to start with our sickle scaler. Now, sickle scaler is designed for supragingival use only, and it is designed for supragingival use because of its pointed toe. It is triangular in cross-section, and it has 2 working blades on either end of the instrument. Now, when we use this instrument, We say it's for supragingival use, and it can be used anywhere in the mouth because it is a universal, but because of its shape and its straight terminal shank, it is designed mainly for your anterior 3 to 3 use, top and bottom. So this instrument, when we say supra, we also want to get you slightly into the sulcus. So supra calculus will sit just slightly under the sulcus. So you don't want to start from that gum line, you want to slip it slightly under that sulcus there. So the same as we did with our 11-12 Explorer. Again, for ease of viewing today, we're going to do the 1-3 to the 2-3. So we start on our midline of our 1-3 for all right-handers. For left-handers, you may want to start on the 2-3, but that is a personal preference. So we insert the toe of the blade. So again, we mentioned we've got the toe, the middle, and the heel of the blade. We only want the toe or the end third adapted to the tooth. We get a much more power in that end third, and that's where we can adapt and control that instrument. If we adapt the middle third to the tooth, you will find that the toe will kick out and cause trauma to the gingiva. So we're going to start in that midline of that 1-3. We want to insert that blade and then tip that handle of your blade towards the tooth so we get an 80 to 85 degree angle on that blade. We then want to apply lateral pressure to get underneath the calculus. You want to have a stable fulcrum or finger rest near where you're working. Apply that lateral pressure, and we want short, overlapping strokes, working our way into the contact. Now, we talked at the start, is our power coming from our wrist? So when we do it, our wrist is what is working, our wrist forearm rock to roll and adapt that instrument around. What we're not looking for is your power coming from your fingers only. As we said, you'll fatigue and there'll be no power. So once we've rolled into that contact, you will then move on to your next tooth. Again, insert and open. We want a short strokes, working our way around to that interproximal area. Now, if you don't roll your instrument between your fingers, you'll find that the middle third is what will adapt, and that toe will come out and will pierce that propeller. Now, that's with the pointed toes, you've got to be very careful that you roll quickly on those interiors and keep it adapted. And working our way around into our canine. Once we've reached our canine, the distal of our canine, we will then come back and do our surfaces towards. Now, when you look at your instrument, you'll find that it'll swing to one side. So universal, don't make this a complicated instrument. A lot of people overcomplicate your sickle scaler. As long as that tooth is that end third is adapted, your terminal shank is parallel to the long axis of the tooth. Once you become interproximally, you are safe. So generally, when you come back from that canine and do your surfaces towards, you will generally flip your instrument and come back. So that is our sickle scaler. Now, our next instrument is our jaquette, or our SJ3435. It is very similar to your sickle scaler. They are both triangular in their cross section, and they both have a pointed toe or tip. Now, the thing that makes this one a little bit more specific is it has a longer shank on it. It has an angle on the shank, and it allows us to get a little bit more to our posterior teeth. So universal instrument, it can be used anywhere in the mouth, but because of its angled shank, it allows us to get a little bit more to posterior use. And it is a very good instrument to removing heavy buccal calculus along those upper molars. So when we look at this one again, we want to make sure that that terminal shank, which is always your lower shank, is parallel to the long axis of the tooth once you become interproximally. So we're going to do this one on a molar tooth just to make it a little bit more where we're going to be using it. Now, when we actually get there, we want to adapt that terminal shank. So you'll be able to see that terminal shank is parallel to the long axis of the tooth. We can use this instrument in many ways, but as I said, the true easy way to use this instrument and a great use for it is working along that buccal surface. So coming along from our distobuccal line angle to our mesiobuccal line angle, which we call our true buccal surface, and working nice horizontal strokes coming along that surface. Now, when you first start your instrumentation, control is not quite there for your horizontal strokes. So your best action will be, in that case, to do nice oblique strokes coming out of that pocket. Now this instrument can also come into the interproximal contacts because it's nice to actually reach in those interproximal contacts, and because we have that extra shank and extra curve on our shank, we're able to get to those distal surfaces a lot easier. So again, coming along and we can work into that distal contact. So nice instrument used for interproximal, nice instrument to use for your true buccal surfaces. That's your SJ3435. It can also be used on anteriors. As we say all the time, universals can be used anywhere. It becomes an instrument of choice, whether you prefer to use this instrument or you prefer to use your sickle scala. But the same thing, if I show you on this 1-1, you'll start at that midline and you'll work your way around into that interproximal contact, making sure that terminal shank is parallel. You will then, if we're just doing that 1-1, start in that same buccal area in the midline and work your way back around to that distal contact. Again, making sure terminal shank is parallel. So very similar instruments. This H67 more dominant in the anterior region, and your SJ34 is more dominant in the posterior region. Now the last of our universals that we have in your kit today is your 4R, 4L. Now it's a universal curette. Because it's a curette, it has a rounded toe. Now anything that has a rounded toe is used predominantly more for subgingival scaling rather than for your supragingival scaling. Now it will differ from your Gracie curettes, which we'll cover in a moment, because it has 2 working blades either end. So that's what makes it our universal. Now this instrument can be used anywhere again, universal, but it is predominantly used for your posteriors. They have made an instrument called the 2R2L, and it is used a little bit more for your anteriors because it is much narrower. So it's quite a large, flat, wide instrument, best suited for your posterior work. Now I'll show you first on your anteriors, just so if you do use it there, you'll know how to adapt it. Now with our 2 working blades, we always have to make sure we've got the surface adapted. Now this one is a rounded toe, it is semicircular in cross section. It has the 2 working blades as I mentioned, and it's for subgingival use. Now when we use this on our anteriors, we want to make sure that your outside blade is closed off or rounded, so it should be hugging the tooth. So what that means is once you place that into the tooth, you want to find that this outside edge is closed rather than open. And we'll do a demonstration showing the difference with there. If we have it open, it's going to be causing a subgingival curettage of that papilla. So it must always be closed off. So we still start in the midline as we do with any of our anterior work. We work our way around into that midline, into that interproximal area. Okay, so again, solid fulcrum, wrist forearm rock, rolling that instrument between your fingers to adapt to the line angles, making sure the end third is what is adapted, not that middle third. We will then work on our surfaces away from us, as we've done with all our other instruments, ensuring that that terminal shank stays parallel as it goes into our interproximal areas. Now when we come and do our surfaces back again, same as what we did with our jaquette, is we turn the instrument over. So we flip it completely over and we do our surfaces towards us. Working back from that midline into that interproximal contact. Okay, looking for that terminal shank to be parallel. But you must check that your blade is closed off so it's not causing any gingival trauma to that papilla. Now, it's predominantly, as I said, used for your posterior use. So when we divide our tooth up for our posteriors, we're looking at our molars mainly. Now our molars, we divide it into 3 surfaces on the buccal and 3 surfaces on the palatal of the lingual. Now when we divide into those 3 surfaces, we are looking for the distobuccal line angle. The distobuccal line angle goes from the tip of the distobuccal cusp to that gingival margin. That's your line angle. Your mesiobuccal line angle goes from the mesiobuccal cusp tip to the gingival margin. Okay, so that's our mesiobuccal line angle. When we're using our 4R, 4L, we divide it into 2/3 and 1/3. So we start from that distobuccal line angle and we move around to the mesial, and then we'll come back and do that distal pocket. Now when you adapt your 4R, 4L to the posteriors, we want to always adapt it to the mesial first. So once we adapt it to the mesial, we want that outside blade closed off. So that blade or the face of the blade should be hugging the actual tooth. And again, you'll see if we have it the other end, you'll find that face of the blade looking at you. Again, to get that terminal shank parallel, our handle has to tip towards the back of the mouth, and that's not what we want. So we don't want that. As soon as you see your handle tipping to the back, you need to swap because you've got the wrong end. So it's closed off. So we're going to start from our distobuccal line angle. Now, when we start from our distobuccal line angle, as we talked about when we're using the universal super instruments, ideally you want to be using your horizontal strokes. So starting from that distobuccal line angle, coming across in horizontal strokes. So again, if you don't have the confidence when you first start your instrumentation for fear of slipping and causing trauma, you may use your oblique strokes. So if you slip, you're coming out of the pocket or out of the sulcus, not into the sulcus. But for the purpose today, I'm going to show you using our horizontal strokes, starting from that distobuccal line angle, working around that buccal area, true buccal area, and then we want to change our positioning and coming around into that mesial contact. So remember, when we get into that mesial contact, your terminal shank, which is your lower shank, needs to be parallel to the long axis of the tooth. Now, we've talked about fulcrums needing to be stable. Our fulcrum can either be intraoral or extraoral. Now, there's no right or wrong in your fulcrums. The things we look for when you're fulcruming is that you need to be stable, you need to be able to apply lateral pressure, and you need to have control. So we can have an intraoral fulcrum in here, or I've chose to fulcrum on that lower jaw, either on the tooth or on the chin. So fulcrums is something that you need to work out yourself. We'll have our basic fulcrums, but they always need to be adapted depending on the patient you're working on, whether there's teeth present there, whether there's mobility present there, and many other factors. So our fulcrum is something that we work on a lot during your class. Now, once we've done that buccal side, we will then come around and do our palatal side. So remember, we're wanting to change the position of the patient. You're either changing your operator position, your patient position, or both. Now, you will need your mirror vision to do the palatals of this first quadrant. So again, we want to adapt that instrument to our mesial surface. So once you adapt it to that mesial surface, you see your outside blade closed off. We then start from that distopalatal line angle, work our way around that palatal surface into our mesial contact, making sure our terminal shank is parallel. Then we'll come back to our distopalatal line angle and we'll work into our distal contact. Okay, so now we're going to work on our Gracie curettes. Now, our Gracie curettes are area-specific curettes. So they are similar to your universal curette in the fact that they have a rounded toe, but because they are area-specific, they only have one working blade and it's offset blade. So they have the semicircle and cross-section the same as your 4R, 4L, but our one working blade, which is offset, is what makes it more efficient when we're working with deeper pockets. So the Gracie curettes that you have in your kit are the 1-2, the 7-8, the 11-12, and the 13-14. So there are others out there, but these are the ones that we're going to show you today. And as I said, the basic technique that you're learning here will adapt you to any instrument that you pick up, terminal shank parallel to the long axis of the tooth. Now the 1-2 is used for anteriors and it's used for all surfaces of anteriors. So determining your working blade is the hardest thing when we're using our Gracie curettes. So we must hold the instrument straight up and down, so it's looking for that lower shank is your working shank. So the face of the blade looks towards the ceiling, you reflect the light onto your instrument, you see the face looking at you, and the lower blade is your working blade that you adapt. Now with your anteriors, we're working the same as what we've done with every other instrument today, working from that midline of your canine, doing all our surfaces away from us, and then flipping and doing our surfaces towards us. So again, we need our nice fulcrum, nice solid fulcrum. We need to have our terminal shank parallel to the long axis of the tooth. Once we get into proximately, you need to roll your instrument around the line angles, and we're rolling that with our fingers, not with our wrist. Once we reach the distal of our canine, we will then flip it so that outside blade is closed off, our blade is activated, and we do our surfaces. Keep losing our tooth there. Our outside blade is not causing any trauma to that gingiva, and it's getting in there. Now, when you adapt or when you insert your universal or your Gracie curettes, we want to insert at 0 and then open it up, engage that blade. So hug the tooth, slide it subgingivally, and then open and activate it. And then you can start your vertical strokes working into that contact. So that's our Gracie 1-2. Now, all surfaces on anteriors. Now we're going to move on to our last 3 instruments. Now these are used together. We've got our 7-8, which can be used for all surfaces on premolars, and that's the one thing that we don't use it a lot for, but you can use mesial and distal of your premolars. But what we're going to show you today is how we use this one on our posterior teeth, being our molars. It is used for the true buccal or true palatal or true lingual surfaces, so that broad flat surface. Now when we talked about our 4R for L, we divided our tooth into 3, and we did the 2/3 and then the final third. This time we're going to divide it into 3 and do each third on its own. So our 7-8 will do that broad flat section from the distobuccal line angle to the mesiobuccal line angle. That's what it's designed for. So if we're doing that 1-6 again, we'll start with your 7-8. Now there's no right or wrong where you start. Now remember, we want to get our blade, hold it straight up and down. The face should be looking at us, and we're looking at our lower shank as being our working blade. We want to take it in. We adapt it to that distobuccal line angle. Now again, whether you want to use the horizontal strokes, if you have the control, working from that distobuccal line angle to the mesiobuccal line angle, or if you don't feel you have the control, then you go back to using your oblique strokes. Okay, your choice. But the 7-8 is used from distobuccal to mesiobuccal line angle, and also from the palatal broad flat section. Our 11-12 is for mesial surfaces only on your posterior teeth. Now our 11-12 and our 13-14, we start to change the shank of the instrument. So our terminal shank that we need parallel is always our lower shank on both of these instruments. The lower shank is always your terminal shank. So because of it's more curved, it allows us to get to our posterior teeth more efficiently. So again, we need to get our working blade. So our terminal shank must be parallel or straight up and down to be able to work out our lower blade. Face of the blade looking at the ceiling, reflect the light on it, pick your lower blade. That lower blade then needs to adapt to the tooth. So once you've determined your working blade, we then want to start from that mesiobuccal line angle where you left off with your 7-8. There's no need starting back any further. A slight little overlap on that where our starting point, and then you will work your way around into that mesial contact. Okay, so mesiobuccal line angle into that mesial contact. Now when you get into that coal region, on Charlie you can't quite see it, but once you get into that coal region or that contact region, you will be doing short little strokes because you will reach the contact. Now always in some teeth there's a little fossa in there, you've got to make sure you remove that calculus in that area. So just nice little short strokes getting up to that coal region and then back down again. Don't pull in and out of the contact, just stay in there until you've removed that calculus there. We then need to do our distal contact. To do our distal contact we use our 13-14. Now a 13-14 is for distal surfaces only of our posterior teeth. Now this one I always say is a no-fail instrument. You can't go wrong with it, and everyone proves me wrong every year. You need to find your, again, terminal shank parallel. Now your terminal shank is your lower shank. If you have it on an angle, you can pick your lower blade anywhere. Your terminal shank must be straight up and down, the face of the blade looking at the ceiling. Then you can detect your lower blade. That will be your working blade. Now when we then adapt that to our distal surface, we start from our distobuccal line angle and we work our way around into the distal contact. Okay, again working in that coal region and getting right in between that contact point. Now the only time you scale towards the distal when you're doing your posteriors is when you do the distal. So every other thing from your distobuccal line angle, you always scale forward, always scale towards the mesial or the front of the mouth. You only turn your instrument to face the back when you're doing the distal surfaces. Only time. Once we've done that buccal surface, we'll then flip our Charlie over to the other side, use our mirror vision, and then we'll then repeat the process. 11, 12 working into your mesial contact, 7, 8 on your true palatal contact, and 13, 14 into your distal contact. So basically today we've covered the instruments in your kit. Now the things that we look for all the time and we'll refresh your memory each time are the basic things. Your modified pen grasp, most important, you get your modified pen grasp, correct grip of your instrument. You need to then get your solid fulcrum close to where you're working, and then you need to decide whether it's going to be intraoral, cross-arch or extraoral fulcrum, as long as you are stable and have your control and can apply pressure. We then need to adapt the very end third of the instrument to the tooth and roll it in your fingers around the line angles so that toe stays adapted and doesn't kick out into the papilla. We then need to get your wrist forearm rock, power coming from your wrist, not from your finger flexing. And of course then watching your posture, nice correct posture, feet flat on the floor, moving patient and moving yourself around to correct positioning. So if you can stick to those few basic rules, those rules will apply for any instruments you'll come across once you graduate. Any new instruments, always that terminal shank parallel to the long axis of the tooth and adapt that end third of the instrument. Good luck guys, hope you enjoy.